Yeah. Yeah.
Hello, social workers, mental health professionals, and change agents. Welcome to another episode of the Social Work Rants podcast. I'm your host, Bass Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to this podcast. I appreciate all the love and support or the feedback I've been getting, especially recently with a lot of dope guests, a lot of dope topics. Continue to support, follow the podcast on all social media platforms, starting with Instagram at the Social Work Rants Podcast. That's all one word. Follow the podcast on Twitter at Social Work Rants and hit the like button on Facebook, aka Meta. Type in the Social Work Rants Podcast, hit that like button. And of course, on YouTube, follow along, type in the Social Work Rants Podcast, hit that red subscribe button, leave comments, hit the like button on the videos if you like the video. Got a lot of interesting topics that already have covered so far season six, and we continue to roll on and drop weekly podcast episodes. It's difficult sometimes, but I'm making it work. So I appreciate you guys are rocking with me. Gracias a todos por su apoyo. This episode of the podcast is brought to you by Bass City Entertainment LLC, your home for your online holistic self care, feature poetry, and monthly Zumba classes. And of course, for those who haven't gotten the book, make sure you get the poetry book, Trying Through Pain, How to Maximize Your Full Potential During Hard Times. 30 pages, front and back, is available in paperback. Go to bassmoreno.com or you could get it on Amazon as well. And I've been slacking, but the audiobook is coming soon. So and that's in the works. So again, for those who bought it, I appreciate it. All the love and support for the book. And of course, Latinx and Social Work Volume 2 is also out on Amazon as well. And I got a chapter in that as well. So my guest at this time, Jacob Kendall, come from Alabama. I finally hit Alabama.
Nice.
One of my goals to talk to a social worker in all the states. So Alabama's checked off. So Jacob, how you doing?
I'm doing well. I'm curious to know how many states you've done so far.
Oh man, I got like most of the East Coast. There's still a few in between, and then I still got quite a few in the Midwest, and then like still got Idaho, Wyoming, the Dakotas.
Mhm.
No, there's still Utah. There's still quite a few to go, but
Okay.
slowly. And Hawaii, of course. I still got to get somebody from Hawaii.
All right, cool. Well, I appreciate you having me on here.
No. Of course. I'm glad we were able to connect and talk about the wonderful and challenging world of social work. So, for those who don't know who you are, let people know who you are and what you do in the space.
Yeah. I'll try to be, yeah, I'll be brief. I'm happy to expound upon anything if need be. So, the important part of my professional background in education is that it's interdisciplinary. When I majored in biology in undergrad, and then I knew I wanted to do a dual degree. My dad was a social worker, so I knew social work would be one of those degrees. Um, and I found that there are several different types of really common dual degree programs, and I was attracted to public health. And honestly, my mind probably is geared more naturally toward public health. So anyway, I did the MSW MPH program at Tulane University. I focused on international health and development, and I thought I was going to go work in the field, do some development work in another part of the world. But while I was in that program, Tulane started this Ph.D. program, interdisciplinary aging studies, and I was attracted to the interdisciplinary part of it. I did not think that I was going to be interested in the aging part, but I went ahead and started. I pursued that, and I got into that program, and so Interdisciplinary aging studies is a lot of syllables. I typically just say gerontology. I say I'm a gerontologist. That's what gerontology is the interdisciplinary study of aging. And I had all public health and social work faculty in my dissertation committee. And my first, I thought back in those days that I wanted to do academia and retire as a professor. I've since learned differently, but I do enjoy teaching. So I was a social work professor for a couple of years at a rural university in Indiana, a very conservative evangelical environment. And that is a really interesting place to teach social work. I'll say that. But that was only a visiting assistant position because I don't have a license, and they really wanted someone with a license. I have some criticisms of that mindset, and I'm happy to get into that if we get to that point. But anyway, I wanted to move back down south anyway, so I next taught at I taught global health for 3 years at a university in Georgia, and then the entrepreneurial bug hit me, and so and I had both personal and professional reasons, health and family and other things, and wanted to kind of strike out on my own. And a lot of things I was doing in the classroom that I wanted to do in different places, other audiences. And so it kind of a confluence of several things. And anyway, I left that position, and I've started a few businesses. The one that I focus most of my time on right now is providing career coaching and like help with resume, cover letter, whatnot to social workers who want to pivot to more macro work. I usually say that I'm so macro that I think social work should have a level above macro. And we're actually seeing this is probably something you and I will have a more extensive conversations. I'll just leave it at this for now. But there's a huge trend right now with social workers wanting to pivot to these other industries, but they don't know how.
Absolutely.
So that's why I designed my program to do that. I'm also part-time in a seminary program, and that was more so just out of personal interest. I'm interested in faith deconstruction, and I think there's some major ethical issues at where social work and other things intersect with religion that I'm interested in. I don't want to do ministry or anything. I don't think the church would have me with my beliefs these days, but I'm more so interested in like knowing how to speak the language and relate to folks, because there's a lot of there's ethical and faith deconstruction issues I want to address. Okay, that's my elevator speech. Thank you.
No, that's very interesting, and I know like I had a a sex therapist a while ago on the podcast, and we spent a lot of time talking about issues with the church and like the sex being still very a taboo subject, especially here in the U.S. and like even like TV shows that were like very popular in like the late 80s into the 90s, and like you can't even like put that on TV now because number one, like people are sensitive, and number two is like no, it's no whatever is not appropriate for our times have changed, and so like is not appropriate for like network TV or even like cable TV. So it's like a lot of things that have changed from that time. So in the church, a lot to do with like the taboos that this happened. So it's interesting that you brought that up, and myself, in undergrad going to a Jesuit school and having brothers as professors or just in the community, in the school community, and interacting with them, and some of them are like strict in the religion, others just regular folk and like listen to hip hop or whatever, and just like kind of like really like in tune with the skew community. So you kind of had like a little bit of both. So it's kind of you talking about that. At least I find it fascinating.
Yeah, for sure.
So I and I've had this conversation also, like definitely I've seen and hear more macro, especially macro coaching, just macro in general. It's probably been like the most popular. I've been in social work over 21 years, and between going to working in the field, then going to get my master's to like, and then over like 10 years postmasters, like macro is like the new like buzzword. Everybody wants to like
Yeah,
pivot.
yeah,
I think COVID has a lot to do with pivoting, and like the whole like 4-day work week is gaining traction, and it's like people finally it I think it took COVID finally realized like I don't want to work 40 hours and I gotta deal with be traffic, or you're like a major hub and take your public transportation going to work. That's an extra like couple hours out your day. And like if I can work from home and do something related to social work and or whatever, then I'm going to do that. So like people definitely like woke up, and I mean, but I still see agencies still just not with the times, or
yeah.
kind of like, so you need to come back to the office or whatever. So like, what are you seeing in terms of your coaching? What are people are looking for? Like just like a little background. You said you got into the entrepreneurial piece. Like, what made you get that bug, and how do you see clients?
Yeah. It wasn't my first business to start, but the other ones are one's a small mental health practice, and another one is we write grants and whatnot for nonprofits. But mostly, I have teams running those now, and I wanted to shift into more. I'm in the process of building like a public speaking business. That's really what I'm interested in, and I want to focus on the macro stuff and some of these issues that I've hinted at so far. But and I created the Wordsmith is where I provide coaching. I created that as like more of a side hustle because I just happen to be naturally good at the very precise kind of language that you need to write a good cover letter or a good resume to ace your interview. And I thought, okay, I'll just create this and it'll be there, and I'll have an occasional client. Maybe that can bring in a little bit of income. But what I found was, um, you know, just like any other small business owner, I was doing marketing. I mainly rely on posting content on LinkedIn, and I really wasn't targeting social workers at first. I was just targeting whomever needs help with a resume or cover letter, and so I posted on several different several different topics in the span of maybe 2 or 3 weeks. Given my interdisciplinary background, and I wanted to see if any of them hit, and one did hit. I had this post that was basically about it hit a lot of pain points that social workers are feeling right now. And because I got so much response to that, that told me, okay, I'm going to hone in on social workers who want to make the pivot. And so what I found, and what I have found to be the case since then, this is several months ago, is that social workers are increasingly feeling burnt out. Um, they want more flexibility, like you're talking about, which COVID has largely brought on. They are very underpaid, underappreciated. You know,
Mm,
they notice that they're working on these interdisciplinary teams with physicians and nurses and other folks working at least as hard, if not harder than those people, but they're paid the lowest. And they also find that they're not able to um, address the systemic issues that they're seeing with healthcare, mental health, et cetera, by only being a clinician. Because when you're a clinician, you're largely interacting with individuals, couples, families all day, and they're starting to realize, a lot of people are starting to realize, wow, I really want to address these larger, more macro issues, and so they want to shift. But and this is where I could easily get into a long, well, the social work rant. I could get on a long
mhm,
rant about this. What they're telling me, and what I know to be true, is that they're not prepared to uh, find a job in the macro space because they're not trained. The social work, what I could get on a rant about is that the social work profession is not up to the task with macro work. People are overwhelmingly trained to be clinicians. Like they just send you through this funnel. Like,
mm,
okay, the ultimate goal of social work is to get your clinical license and then start your own practice. But what about all these dozens of other things that social workers can do? And so my clients tell me, I don't even know where to start. Like, how do I find these jobs?
right.
And then some of them are applying for a lot of jobs, but they're not getting any callbacks or anything. So they don't know how to like convey that they have these skills because they've been a clinician for years. Um, and then another thing that really hits the pain point for social workers is that there's this notion that the phrase that I use is that we're expected to sacrifice ourselves on the altar of martyrdom. And what I basically mean by that is like I have clients who tell me their professors have told them, well, you don't go into social work for the money. Well, you should want to make more than $50,000. And there's almost this sense of guilt that if
Mhm.
you want to make enough to provide for yourself, that's just evil for a social worker to want to do that. I call BS on that. No,
So
I
do
don't
I.
accept I don't accept that at all. I do not accept that. And so I also help my clients with salary negotiation. And I try to tell them, like, listen, this might take a while because that notion is so deeply entrenched within your social worker brain. But I want to work toward getting you to the point of believing that you deserve a higher salary and to be happy. And it's okay to have some money. It's okay, right? So let's work on all those pieces. And so that's what I'm finding right now. And my clients want to go and do all kinds of things. I mean, I can't think of an industry I have. There's no industry at this point that I've not met some social worker who wants to go into that industry, and that's great. Social workers have the skills to work in any industry.
No, yeah, and there's more and more education and interacting with other coaches or social workers who get into career coaching and the same things. You mentioned. They mention also, and is definitely a whole switch. Definitely, people are more educated now and definitely understanding the transferable skills that we have in professional shoe. I'm still learning that myself because I'm trying to get into doing more speaking engagements, myself or try to make additional income besides my 9 to 5 and for myself I've always been about the income. That's how I even got into the field in the first place, to provide for myself. And then once I had my kids, it was like definitely okay, what's the next move so that like I can make a little bit some more money, whether if I gotta leave a job and make some more money, or then I'll leave a job so I can make some more money. So it's like this whole notion about you know being in, being shamed on because you want to make a living or whatever is, you're right. I call complete BS on that too, especially with housing being expensive as it is. We're in
Yeah,
inflation. We're in a recession on top of that. With even though the government refuses to admit we're in a recession, we're in a recession,
yeah,
and all those. Factors. We still, I've mentioned the last few episodes of the podcast about we need to start having conversations about the after effects of COVID that we are still learning, and people don't want to talk about that. So people are really struggling out there, and is we need to have these type of conversations. And yeah, like we need to make some money.
yeah,
It was just as survival, like just for basic necessities. We need to make money, and we need to make multiple streams of income somehow. However, that's going to look like, it depends on the individual and their individual circumstances.
for sure. Yeah, definitely.
Um, now, from what you've seen, what do you think that is the switch to macro? Like I said, it's probably like the hottest I've ever seen. Like I've seen so many stuff. I've seen between education on what you can do with just an MSW, so no take test taking, nothing. Like these are jobs that you could get with an MSW. To okay, you want to make the switch. You've been doing clinical your whole career. Now you want to switch to macro, like, and going into that realm, like that macro switch, from what you've seen or just observing or even just social media. What do you think that came from?
Uh, I think it's coming from. I think society is shifting more overall into a place where we're realizing that this individualistic perspective is not going to cut it, right? Um, so when people ask me how to define macro, the most common example I use is let's think about something like obesity, right? A very common response in a conversation about policy to address obesity is, oh, well, people are just lazy. They don't want to stop eating. So why would I want to have a policy to support them? That's focused on the individual level, individual behaviors. But what many people don't realize is that there are a lot of folks in the U.S. Who have obesity, but they live in food deserts where they just literally have no choice. The only food option they have within miles are convenience stores with processed foods, and it's not a good situation. And there's no decision making that they can make that's going to change that situation. And that's more of a macro perspective. And I think that society in general, social workers included, are catching this drift more and more and realizing we have to have a macro, more public health, epidemiological way of addressing these problems, because this individualistic medical model way of seeing these problems is not, it's not sufficient. It's not solving our problems. And there is that piece there with social work. I like the fact that we include the macro part of it. Like I'm glad that it's theoretically there. I just don't think that it's done well enough. And so social workers have that foundation. Unlike they're more, I think social workers are more likely to have a good starting point for going in that direction compared to a physical therapist or a physician or a nurse, where all of their training is on the micro level, right? So I think that that's one issue. I think a lot of social workers are also very specifically fed up with the reimbursement rates for health insurance, um, and other issues like that, especially around mental health.
Which is only going to get worse.
Yeah, it's not going to get better, and uh, there's absolutely no way that these problems are going to be addressed if you just continue being a clinician and complaining about it. Mm-hmm. And so I think a lot of social workers are like, okay, well, I'm so fed up with this that I'm going to go into policy advocacy or do something else at the macro level to try to make some of these changes. So I think it's coming from a few different directions, and things like COVID are a great example of it. It's pretty obvious that a pandemic makes it glaringly obvious that a health issue does not merely exist at the individual level. Sure, it's COVID. I mean, a lot of individuals suffered from that. They couldn't see family members due to isolation, of course, all the deaths due to COVID and whatnot. But the pandemic is a social issue, and it's obviously like no one can reasonably deny that. And so I think the fact that we've recently been through a pandemic, it put us on that path on a bit of a hyperdrive. We were already headed in the direction of embracing more of the macro, but something like the pandemic made that go even faster. That's my opinion.
And the reason I bring up reimbursement rates are only going to get worse, considering as of this recording, I see more and more articles coming out about Social Security. There won't be any more money by 2034, and there's more news about that, and also news about cutting Medicare and Medicaid, and that's around that same time period, if not sooner. So of course which doesn't make sense because people are living longer. There's a lot of outpatient mental health clinics who rely on Medicaid dollars, people who do case management and bill Medicaid. Obviously they get those reimbursements, even though the reimbursements get cut. At least that's how they survive. That's how people get salary through that. So it's things are vastly going to get uh, worse real soon, and people need to open their eyes and kind of see that, and a lot has to do with the federal deficit that the country has. So,
Yeah.
of course, they always do social services first before they do
No.
anything else. So it's like it's a lot, and I think that kind of like gears social workers into the policy as well. It's like, why are you cutting this stuff? Is this stuff that we need? We in a mental health crisis and stuff. So it's like we need these things for people. So like, why would you cut that? So it's a lot. I think social workers definitely need to keep their eye on just on the economics and at least do their own like research or just follow people regarding the economics and based on this country and just the world also why we depend on other countries for stuff. So it kind of relates to kind of like a back-ended way somehow it trickles down to social work. So it's been interesting to say the least, and like I said, it's just going to get worse,
Yeah,
unfortunately.
it is. Yeah. Yeah.
So you mentioned you working in Alabama. Just to get like some educational context of what like from like the ground level from what you seen like your day to day, like what like describe like it like what you're seeing in your community.
Well, I haven't been, let's see, I haven't been living here for 2 years. I grew up in the Birmingham area, and then I lived in Louisiana, Indiana, and Georgia, and then moved back to Alabama not quite 2 years ago.
Okay.
So that's one thing. I'm definitely still learning about where I live, and it's one of those popular places to live in the state. Um, so there's a lot of folks moving down here, but it's very middle class. It's very white, um, and it's close to the water, which is nice. But we don't like everything about it, obviously. And I also all my clients are remote. Like I don't work with my clients in person.
Okay.
Um, so admittedly, I'm still kind of learning about the area since I don't go to an office and I don't see people in person. It has meant that I don't always. Sometimes I know more about what's going on in other states than I do my own.
That you and me both. Well, I'm originally from no from New York and moved to Delaware, so I'm still like every day is try to learn a little bit something more about the state and like what was there to do or you know I drive like almost an hour and a half every day to go to work, so I kind of and I drive basically have to drive through the state. It's a small state to get to work, so I kind of like get a sense of at least my ride of what was out there and with my job learning like the different agencies that to try to help assist my patients that I work with. So it's I'm still learning as well. 2 years and change in, so it's fascinating to say the least. And I even saw like the governor here in Delaware had a town hall as of this recording today, and like the big thing, well, one of the big things is recreational marijuana. There's like a couple
Mhm.
bills on his desk, and he's refusing to sign it, and it's been an ongoing issue, like at least the last 3 or 4 years, definitely since I moved down here, even before then. And he's like, "No, I'm not signing it." And even though the state legislature like kind of signed it, all he has to do is sign it, it becomes law. So that between that and all the infrastructure in terms of townhomes and single family homes here, but yet, no, like I mentioned that last couple of weeks, the podcast of like single family homes and townhomes, but no like affordable housing, real affordable housing or apartments that people could actually live in or shelters here are being built. So it's like kind of like nationwide, there's been a housing shortage, and people. need homes that to live in. So, are you seeing that as well from what you've seen, or since you've been in Birmingham? I know Birmingham's kind of blowing up a little bit as well. I know they got the USFL and then with the stadium, so that has that like kind of like help with like booming in terms of the economy or anything like that.
Yeah, Birmingham has definitely made an effort to come back, so to speak, in the downtown area. There are definitely some parts of it that have where they've clearly done some things to draw more people to visit and eat at restaurants and things for tourists and whatnot. So that is for sure clear. Um, you had another question there. I may have missed it.
Well, I mean, so it's almost like, have you seen like in terms of from social work, like kind of like gentrification of like the area, or you see like any terms of like housing issues as it relates to like making improvements to the city?
Um, well, I grew up in Shelby County, which is just south of Jefferson County. Jefferson County is where Birmingham is, and there's a stark difference between Shelby County and Jefferson County. Uh, a lot of the areas around Birmingham are struggling, I guess is a way of putting it. And so a lot of folks who can afford to do so live in one of the surrounding counties, especially Shelby County where I'm from. So to out-of-staters, I say I grew up in the Birmingham area, but it's about 20 minutes south of there in a different county. And you're talking about a very different kind of situation for sure. Um, and I haven't lived in the Birmingham area for several years, so uh, I don't know. I don't know that I can provide much more detail on
Got
that.
no,
Yeah,
understandable. I just want like at least for the viewers or listeners, because people have like this, I guess TV and movies and stuff have this like portrayal of how Alabama is, and I know
yeah,
within
yeah,
with politics and like the politicians and stuff, there was a lot of I think the what if it's with the senators or something like that that Trump supported, and like it kind of
yeah,
kept back and
yeah.
forth with that whole big Senate race. I think it was like in 2000 or even before that. 2000,
We've had a few.
yeah. So
We've
it's
had a
been
few. Several years ago, it was Roy Moore,
right.
and
That's what I'm thinking about. Yeah, that's what I'm thinking
that
about.
was 6 years ago, I think, and he had accusations in his past of I want to say some kind of sexual activity with minors. Um, and he's the one that with the Ten Commandments in front of City Hall Montgomery, he was up against a quite liberal Democrat, and it was a nationally known. I was living in Indiana at the time, and my colleagues in Indiana knew about that race in Alabama.
Mm-hmm.
Usually, our politics does not make the national news, but that case it did, and the Democratic candidate barely, narrowly beat out Roy Moore, and I'm glad that happened. I just hate that it was so narrow. Um, and then after that, it was the football coach, a former Auburn coach, Tommy Tuberville, beat out that Democrat who had beat Roy Moore. And so we do have a past of um, having occasionally Democratic senators or a governor here and there, but it always goes back to pretty quickly goes back to the mean. I do not like politics in this state.
um, yeah, it's interesting to say the least, and even like I try to stay away from politics if I can, but I just still wanted to give that educational piece and how that relates. It kind of related to
Yeah,
social work, so it's like you got a senator and everything that happened with Roe versus Wade, and we still
yeah,
haven't heard um, the Supreme Court make a decision about the student loans that Biden administration tried to do. So it was like,
Yeah.
all these different things, and new stuff keeps happening, and so it's important to be abreast of these situations. Just like we got to be abreast of like code of ethics and everything else related to social work for our license. We got to be what what's happening in the news, and it starts on a local level and all the way up to the feds. So it's like it is it is important. I just wanted to try to like give some like educational background, especially for all my out of the country listeners and viewers that
Yeah. Yeah.
like what's going on in America.
Yeah, I'm with you. I really struggle with the um it's in our code of ethics to like, be politically involved and advocate for policies that will help our clients who are generally members of vulnerable populations. And some days I'm really fired up and I'm like, okay, yeah, let's tackle this issue. And other days I'm like, quite frankly, with everything going on, part of me just wants to go live in a cabin in the woods because it's just like, oh my gosh, there's so much. It's hard to it can be overwhelming. So I resonate with what you just said.
But it was also in our code of ethics now, all about self-care too. So if you don't want to be bothered, it's like you could kind of use that as excuse too. It's like not today, tomorrow I could tackle that.
Yeah. Yeah, that's true. Yeah, you're right. You're right. Yeah.
That's just just saying this. um, and all that stuff about the self care stuff. I think I'm still stuck on the last code of ethics, and I haven't like fully upgraded to the new version of the code of ethics. So that's something I got to do some homework on myself.
Yeah. Yeah.
No, you didn't mention about offline about ethics, and the kind of we could kind of lead in, into that. When you talk about ethics, are you talking about related to like the macro work that you're doing, or just like in general?
Yeah. I think this is best if I tell you a story.
Yeah,
It's
absolutely.
it's it's a quick story. So my organization that provides um sorry, my alarm was going to keep going off. I had to reset my alarm to a different time. My organization that provides grant writing services to nonprofits. It's called Groundwork Resources. And one thing we do, we host social work interns, um, both BSW and MSW students who are doing their practicum. And with most social work departments that I reach out to, they're really thankful that I did so just because they have a hard time finding macro placements. And plus, we're fully remote. That's also quite convenient. So, anyway, we've hosted several practicum students at this point over the past couple of years. Well, I was reaching out to a a large social work department at a large university that has a they are a nationally recognized research university, but they also have a strong Christian identity, Baptist specifically. And sometimes I had no particular reason to reach out to them. Sometimes I'll just say, "Oh, I don't have a relationship with any departments in this state," and I'll just start doing so. There was no particular reason. I just knew that they were a large program, and so I got to talking to the field coordinator, the person who helps students get placed in their practicum placements. That's usually the person that I have to interact with to build a relationship to like become a site who can host their students.
Right.
And we ended up finding out that we had other personal connections, people we both knew together, and had good rapport going with her. So I acknowledged to her I told her who one of our clients is. And one of our clients is, I wish that I could name them because I think that would pack a more powerful punch, but I'm not confidential information. I'll just simply say that they are not a Christian, but a faith-based organization that unfortunately ends up having a lot of controversy tied to them. I don't. It's not because of them. It's because of other people's perception of them, and even some violent acts involved occasionally. And so, anyway, just trust me that it's a head turner, and that's one of our clients. And so I told her, knowing that this is a Christian university, like, hey, this is one of our clients, and I think that's a really good opportunity for social work students to be challenged by this, because you got to practice with the code of ethics, and you're not always going to have an easy time with the clients you have to work with, but you got to work with them. And so I told her this, and she didn't have any issues with it, but she got back with me a few weeks later, basically, and said, hey, I have a student who I think would be a good fit, but can this student work with all of your other clients except for that one? And I was just taken aback, and I said, no, no, because that's not fair to our other practicum students, and I think that's a violation of the code of ethics, and I do, because that's basically saying, oh, you'll work with you, basically picking and choosing which clients you're going to work with.
Right.
And I ended up having a longer conversation with her at a later point. I found out that this is not her decision. It went all the way up to the dean of the department. And the example that I gave her to explain to her why, and she agrees with me, that why I thought this was an ethical violation is because let's imagine instead that we're not a macro placement, that our clients are individuals and we provide mental health care to them. If I were to tell them that, oh, hey, one of our clients is a member of this religious organization, then any social worker should be able to tell you, oh, well, obviously you can't choose not to work with that individual. That's a huge violation of the code of ethics, right? So why do we treat it differently when it's at the macro level? That is a double standard.
Yes,
why is it okay? Why is it okay? I guarantee you that if we went to the state board of ethics and said, in the hypothetical scenario, we're a mental health agency and we have one of our clients, an individual person has this religious identity, and we say we're not going to work with them for that reason, then that would be an issue with the code of ethics. Why is it not an issue when it's a macro, when it's an organization instead of an individual?
Right.
I absolutely think this is an ethical violation. And she told me that this is not her decision, and that it went to the dean, and the dean of this university has to deal, of this social work department, has to deal with a lot of different things. And bottom line is, if that department made decisions that followed the code of ethics strictly, they would probably lose a lot of their funding because the conservative people who fund them would not like that. And I understand that. I just think that it should be acknowledged that that's the case. And so I refer to this as macro ethics. Okay. And I don't think that the social work code of ethics is up to the task as it is currently structured and written of addressing these macro ethics issues. In my opinion, when you read through the code of ethics, it is overwhelmingly referring to clinical work and working with individuals. There are a few pieces here and there that kind of hint at the macro, but I don't even know what section of the code of ethics I would refer to justify the decision that dean of the department made. And I don't necessarily think that he made the wrong decision, because you got to keep your department open, right? It's more complicated when it's at the macro level, because you're dealing with several different types of constituents at both the micro and the macro level. So again, he may have made the right ethical decision. My argument here is that we don't know for sure, because the code of ethics it's not equipped to address this kind of issue. And I think that this is occurring all the time, especially these kinds of issues are occurring all the time, especially where we see faith and religion intersect with social work. And so I think there are a lot of macro ethical issues, and this just happens to be a a story to highlight that. So hopefully my story made sense. Let me know if not, but I'm
Yeah,
like,
it makes sense. Especially, it's funny you mentioned, the code of ethics and the need for a change, because I actually just saw something the other day about I think there's some petition or something going on about having the code of ethics changed. I don't know the ins and outs of the particulars of why it's being asked to change or why a petition is going on, but there's such petition or something that's happening about having a code of
interesting.
ethics changed, and I did see like some wording, being changed. I didn't see the full details of it, but I know there's something in existence.
I'll have to keep my eyes open for that. That's interesting.
Yeah, it's something I literally just saw like within like the last couple of days as of this recording. So,
Okay.
uh, so it's funny you mentioned it, and I know you mentioned no faith, religion, and social work. I think there was even like a conference related to that happened recently as well. So
Yeah.
it's there's like this whole intersection and this whole other I guess you mentioned earlier how social work, we're literally in like everything now, so it's like
Yeah.
another thing to keep an eye on, and just gotta, like, if you keep your eyes open and have your ears open, and like really kind of pay attention. Sometimes things just happen to happen like right in front of your face, and if you get off the Netflix or whatever, you kind of really like see what's happening in the real world, and you kind of really see all these different things that are being talked about, and always try to be around people who are smarter than you. So that's how I even knew that code of ethics petition was even in existence. So because nobody else that's talking about it. So not even on
Yeah.
LinkedIn or anything, not coming from NASW or anything like that.
Yeah. I'll keep my eye open for changes.
um, so you going back to your coaching practice real quick. What do you see as, you touched on a little bit. What is like the biggest struggles that you see with your clients in terms of like how do you like myself, most of my experience has been like in like clinical / case management roles, and like use myself an example. Okay, I want to make a pivot into doing some macro, maybe some policy work. Like what mind frame change do I need to make in my thick head to is if I would like hypothetically wanted to work with you to make that change, what framework what I need to have?
um, I tell my clients to treat the job search process like, or to approach it as if the hiring manager is your client. So meet them where they are. They're not going to meet you where you are, and realize that many people who are not social workers think that social workers take children from families and that's it, right? If that's where they're coming from, then you telling them that you have a social work degree is going to mean anything from they don't care to why the hell are you applying for this job because you're a social worker.
Mm,
So you have to convey your skills and make them very, very, very clear, very precise, without relying on the fact that you have a social work degree. You really have to step outside of your very typical social work mindset. And that also means realizing that you probably have more skills and more diverse skills than you think that you do. Because a common thing I get is I've been a case manager for so many years. I've been a medical social worker for so many years. I've been a therapist for so many years. I don't have the macro experience. That's what they tell me. So then I'm like, have you ever facilitated a meeting? Have you ever gone to present at a conference? Have you started any programs at your agency? Have you tracked the results of those programs? Have you written any grants? And I can go through a list of things, and nearly always I get multiple yeses from any given person. They haven't done all those things, but they've done some of them, and I'm like, okay, you've done macro work. But they have the tendency to want to frame all of their experience through a clinical lens. And so it's kind of taking a step back and realizing that even though you've been a clinician, you've still most likely done things that are going to be valuable skills to the hiring manager of this new job. You just have to convey it in a way that they're going to see that. And so it's really stepping outside of the typical social work mindset. I mean, I tell many clients, because they'll want to put their, the header of a resume, they'll want to put their name and then comma MSW, comma LCSW, because they're really proud of their social work degree, and they should be. But I'm like, you may want to take that off. Just put your name there, right? Because if someone sees that social work degree, they may not give you the time of day. And yeah, I would say that's the thing, is stepping outside of your social work mindset, and meeting them, treat them like a client, meet them where they are, right? Yeah. Does that answer your question?
That makes sense. And I never really thought about it like that. Like you meeting a hiring manager of this macro program or whatever job, and treating them as like the client, and meeting them where they at, and what try to give them or the answers they're looking for based on what the kind of like what they're looking for, and kind of so I like that's kind of really seeing like where where they're at, because I also seen like, okay, like say you have a like a caseload, so like 15 for example, and kind of like each person or family or whatever, each one is a project. You want to do like a project manager, and it's like each, and you kind of like manage the case management aspects of what you do inside of case management. You can actually use that in terms of like doing that for an actual like business or
Yeah.
company. So it's like I've heard that as well. So
Yeah.
it's just interesting. It's the whole mind frame is definitely like you really have to like kind of think about it, and kind of really like, yeah, I've done this, and it's like for myself, I'm still learning, because I'm all from, at least for myself, because I'm always looking at like what's next, and never really try to be comfortable at a particular spot, because you just never know, especially with the economy the way it is. You just never know.
Yeah. True.
So what's you got anything going on regarding your work or the different things that you're doing?
Yeah. Like I said, I started off with the coaching thing being more of a side project. I am gonna get the speaking going here soon, but I realize, in speaking with so many social workers, that I think that in general social workers are just not adequately prepared for macro work, but they have the pieces there. It's more so how to put those pieces together, right?
Mm-hmm.
Um, and so I'm working on expanding what I'm doing, and I want it to be more. I don't want social workers. My goal is not to merely help a social worker get their next job. I want to help them never have to worry about getting a job again. And so, um, you know, that's a lot of confidence building. It's a lot of not just having the goal of getting your next job, but also plan on being promoted and improving in your career. And I don't want social workers to just be in these industries. I want them thriving in these industries and being leaders in these industries. So I'm working on expanding it to where I want to also train them how to do good macro work, right? Not just get the job, but to do good macro work. So I have some visions for it, and I'm trying to be responsive to, you know, all the people I encounter in my professional network and all the clients I get on calls with and whatnot. Um, I'm the type of person I prefer to have my hands in a few different cookie jars. I don't want to just have my hand in one cookie jar.
Yeah.
I like different kinds of cookies.
Now that that's and it's important not nowadays to have more than a different type of cookie, so the multiple streams of income is where it's at, and or at least try to get there, and while still having time to do what you want to do. So I guess that's the ultimate goal, like to make the money, but still without putting as much time as we have been doing, especially in our field and what we do in the profession. That being said, where can people find you?
Yeah. Um, I'm in the process of also revamping my website. Right now it's the wordsmith.us, but you can find me on LinkedIn. Um, and I will be happy to provide, if it would help, I can provide you with my contact information and you can include it within whenever you post the podcast. But Jacob Kendall, I'm on LinkedIn. Um, Jacob.Kendall at the wordsmith.us. Um, yeah, LinkedIn is the best place to find me if they want to email me.
All right, awesome.
I'll type it in here so you can have it, but I'll be happy to provide you with whatever other contact information you want to include with whenever you post this podcast episode.
All right, awesome. Well, thank you so much for your time, and we'll talk soon.
Yeah, thanks, Bass. I enjoyed it. I enjoyed the conversation. I look forward to staying in touch.
Absolutely.